Feeding problems are one of the major reasons why parents consult health professionals during infancy. Problems such as picky eating, food refusal, or oromotor difficulties are common, especially with very preterm children or infants born before 32 weeks gestation. Persistent early feeding problems may impair the growth of the infant and might be stressful for parents. When parents have feeding problems, mother-infant interactions are often problematic. However, this does not mean that parenting is the cause of the feeding problems. It might rather be that feeding problems influence parenting behavior. In our study, we had two major research questions. Firstly, do infants born very preterm have more feeding problems than those born full term across the first 18 months of life? Secondly, what is the direction of the associations between maternal sensitivity and feeding problems across infancy?
Our study included two groups of mother-infant diets, 78 infants who were born very preterm and 105 infants who were born full-term. Their mothers were interviewed about their feeding problems at term, 3 months and 18 months. Mother-infant diets were observed in their interaction, during caretaking and play at the same ages. So we tested 4 possible associations between parenting and feeding problems over time, and these are shown in the following graphs. The first one is an auto-regressive model, which shows that parenting and feeding problems have no influence on each other. And the second one is a unidirectional model, which shows that insensitive parenting leads to an increase in feeding problems over time. And the third one is a unidirectional model, which shows that feeding problems are related with a decrease of sensitive parenting over time. And finally, the last one is a reciprocal model, which shows that parenting and feeding problems influence each other in a reciprocal manner. So what did we find? Firstly, infants born very preterm had more feeding problems at term and at 18 months compared to those who were born full term. Secondly, the relationship between feeding problems and maternal sensitivity over time differed for very preterm and full-term infants. For those born full-term, there was a reciprocal association between parenting and feeding problems from 3 to 18 months of age. This finding means that lower maternal sensitivity increased feeding problems, and feeding problems led to lower maternal sensitivity over time. In contrast, it was unidirectional in very preterm infants. Feeding problems were related to a decrease in sensitive parenting over time, but insensitive parenting wasn't associated with feeding problems.
Our findings have important implications for clinicians and early intervention services. Firstly, infants born very preterm have a higher risk of feeding problems, which may also affect their weight gain. These feeding problems might have an adverse effect on mother-infant interaction, so we should not blame the parents. Secondly, very preterm infants should be assessed for feeding problems at discharge and screened in the first year of life. Clinicians should always ask when consulted about feeding problems whether the infant was born preterm. Thirdly, in healthy term-born infants, feeding problems are likely to arise out of a vicious circle of infants' challenging eating behavior and parents' less responsive behavior. And finally, advice and treatment for both preterm and term mother-infant diets should be to make feeding an enjoyable experience again and improve mother-infant interaction.